Hello everyone, it's Dr. Cary Yurkiw and welcome to today's webinar on wrist pain. Glad you could join us. We want to talk about different conditions that affect the wrist today, and I want to tell you a little bit about myself and how we treat wrist pain in the clinic. I've been practicing for 26 years and I've seen a lot of people with wrist pain in the clinic. A lot of sprains and strains, carpal tunnel, those types of symptoms, those types of trauma and etiology. I've been practicing for 26 years. I saw a chiropractor when I was young for knee pain. So when I was a teenager, I had a lot of pain in my knees. My parents took me to our family doctor, and our family doctor assessed my knees and basically said that I had growing pains. And after going to the doctor over a few times, my family decided to take me to a chiropractor. The chiropractor was the one who assessed my knees, took x-rays, and found the cause of the problem. When he showed me the cause and he went over what he was going to do for me, I was totally relieved. I was happy that someone was going to do something different. And that was important to me because at that time I was growing a lot and I was falling at times, at school and hurting my knees on the playground or touching a desk. And I was in excruciating pain from just the gentle touch to my knee. So when this chiropractor started treatment and my knees started to feel better, it made a huge difference. I could play sports more vigorously. I could have confidence in running and at school, if I was walking through a row of desks, I had the confidence that I wouldn't touch a desk with my knee and be in excruciating pain, have to stop and kind of bend over because of the pain. So that was huge for me. And after that chiropractor finished the treatments, I decided I wanted to become a chiropractor and I wanted to help people. I want to help kids. I want to help adults with the same type of problem. And here I am, 35 years later, practicing chiropractic, and it's been we've helped thousands of patients in the clinic. I started a new practice in Kelowna because our family moved to Kelowna. Previously, I was in Winnipeg and in Penticton for a long time. Winnipeg for 15 years and Penticton for 9. I have flexible hours. We're open on weekends and holidays. So if you need flexible hours, a lot of my patients like that I'm able to see them at convenient times because they work and they want to work around that schedule. Some of them bring their families in on Saturdays. So we do have flexibility with hours. So wrist pain. What causes wrist pain and what can we do about it? Well, a lot of times wrist pain comes from an injury to the joints. So let's say you're playing a sport and you fall on your wrist, on your hand, or you're doing something like a cashier's job where you're swiping the groceries or the items, scanning them, and it's a repetitive type of activity. Sometimes you're sitting at a desk and maybe the desk is too high or too low and there's an angle to your wrist and it's causing sprain and strain to that area. So there's a number of different reasons why people experience wrist pain. If that goes on for a long period of time, there can be wear and tear on the joint, and that causes inflammation, so it swells up, and there's only so much room in the wrist. We'll go over that in a couple slides. There's only so much room, so if there's inflammation, the structures in the wrist, like the nerves and the blood flow, the vessels, can get compressed. They can get irritated and compressed by the lack of space. And that can really start to cause problems with the joints. The joints can start to break down or wear out, and we call that arthritis. So we're going to go over arthritis today too. Before we get into that, let's go over the anatomy and physiology of the wrist. So there's 8 bones in the wrist area, and there's cartilage at the end of the bones, so that protects the bones from rubbing against each other. There's fluid in between the bones. That synovial fluid allows for lubrication and allows the bones to move very easily. And there's muscles running through this area. You can see on the picture on the left here, there's some muscles in the hand area. And then there's tendons running through there, the pink and white tendons here. There's several of them. There's ligaments in between the bones. There's nerves running through, like the median nerve right here. This is the one going through the carpal tunnel. And then there's a couple other nerves in the wrist as well, the ulnar and the radial nerve. They're on the opposite side, so we can't see them in this diagram. And then there's blood vessels that supply oxygen and nutrients to the muscles and the tissues. And there's a couple major arteries, and then there's a lot of vessels and veins running through this area as well. Common conditions that we see, well, carpal tunnel is a common condition. That's when there's pressure on the middle part of your wrist, on the inside part. So there's pressure on this area, and then that causes pain and discomfort in the wrist, but it can also cause numbness and tingling in the first three fingers. So we're going to go over that today and how that happens. Sometimes when people fall, they injure their scaphoid. It's the most commonly injured bone in the wrist, and that's on the right below the thumb, on the inside part of the wrist below the thumb. That's where the scaphoid is. It's the most commonly injured bone in the wrist. Then there's sprains and strains from repetition or poor posture, and there's arthritis that we see. Most commonly osteoarthritis, which is a degenerative type of condition, wear and tear, but sometimes we see rheumatoid arthritis or different types of arthritis, and we have to treat those differently. So carpal tunnel, well, what is it? It's a compression of the median nerve running through the wrist right here. And when there's misalignment in those 8 bones in the wrist, it can press on that carpal tunnel. And if you get inflammation building up, it makes it worse. And then that causes pressure, and that nerve goes to the first 3 fingers, the thumb and the first 2, and actually half of the 4th. So that median nerve picture here, that distribution of the nerve flow can affect that area. If it progresses and it's not treated, it can lead to other conditions, not just numbness and tingling, but then the muscles can start to lose strength because they're not getting the proper signal, the proper energy from the brain down the arm to the fingers. So if the nerve flow is getting cut off at the wrist and you have carpal tunnel, you can start to see some changes after a while where the thenar, the muscle group on the inside part of the palm, starts to weaken and get smaller. So we can see some atrophy. And so what we want to do for that, and I'll talk about this in a few slides, is we want to assess the wrist bones, make sure we have the right alignment of the 8 bones, but we also want to make sure that that nerve flow can get through. Sometimes it involves treatment of the wrist, but other times there can also be interference at the elbow or the shoulder or even at the neck area. So we want to do a thorough job of assessing where the interference is. If it's strictly at the wrist, we're going to do treatment to restore the alignment and the function of the wrist and allow the nerve flow to get through again. Repetitive strain is very common. This can come from a cashier type of job, but also a lot of labor. Plumbers get a lot of carpal tunnel because there's a lot of twisting of like a screwdriver or repetitive movements with wrenches, that type of thing, mechanics. And so this can cause inflammation to build up in the wrist. It can weaken the ligaments and the joints. The joints can not function properly, shift out of place, and become restricted in their movement. And then that weakness can lead to more serious injury and pain. And so eventually it gets hard to grip something, or it gets hard to twist the wrench or the screwdriver, or hard to scan the groceries through, or the items at the store. And a lot of times you'll see cashiers with a wrist brace on because they have this repetitive strain type of injury or carpal tunnel. Arthritis. Arthritis affects the joints, and by definition, it's inflammation of the joints. So here on this picture, they're all red, and it affects the joints that are getting overused primarily. So if you have an imbalance, you're not using the 8 bones in the wrist equally, it can cause some of the bones to get inflamed, some of those joints, and that causes pain. A lot of times on the inside part of the wrist, I find more on the inside than the outside part of the wrist. If there was a previous injury, that can set the area up for degeneration and arthritis, and it could progress faster than the other joints in the body. So you can have increased wear and tear where there's been a previous injury, especially if it wasn't treated before, it wasn't corrected or restored back to the way it should be. And so this uneven wear and tear, we can see that on x-rays when we take an x-ray, get a diagnosis of arthritis and misalignment, and then we go about treating that to restore the movement and the alignment as best as we can, depending on how long the problem has been there. Sprains and strains, fall off a bike like this. Sometimes in basketball, I know my son plays a lot of basketball. You know, if you get tripped or if you fall and on an outstretched hand, that's a common way to injure the wrist. And it's that scaphoid bone, that one big bone in the wrist, that it gets injured the most. We do x-rays in the clinic, digital x-rays, to assess that type of injury. We want to see if there's a fracture there first, and then refer to orthopedic surgeon or somebody like that can deal with the fracture. But if it's not fractured, and most of the time it's not, we're going to go about treating the wrist using adjustments to correct the misalignments and restore the function or the movement in the wrist. So when someone comes to our clinic, what do? We assess the wrist first. We're going to get a history so we understand the background of the condition. We'll do the assessment of the wrist. We'll also check the hand as well, and we'll check the elbow, the shoulder, the neck, and the posture, because sometimes the nerve flow is affected in two areas. It can be affected in the neck area, but it can also be affected in the wrist area, something called the double crush syndrome. So we see double crush syndromes sometimes in the clinic too. Once we do a proper assessment, we let the patient know what the diagnosis is. Then we go about treating it. And with treatment, we use hands-on or instruments to realign the wrist bones and to restore the function. Sometimes we'll give supports like a wrist brace or a wrap or some exercises to do at home. We'll give some advice as far as ergonomics, how you should be using your wrist at work or at the desk if you have a desk job. And then we want to follow up. Initially, we follow up very closely, maybe every couple days, to see how the patient's progressing, do treatments. It's like 2 steps forward, 1 step back. But as the treatments progress and the patient starts feeling better, we space out the appointments, get the patient doing more at home, and that can lead to correcting the cause of that problem. The treatments in the clinic, I like to use this instrument called an activator in the clinic because I find the activator is very specific and the bones in the wrist are small. So if I can apply a certain amount of force, and I can adjust that instrument to apply a certain amount of force, and it's gentle and it's effective, then we get the best results. Sometimes I'll use hands-on adjustments. I know my wife often has a problem with one of the bones in the wrist popping out, so I'll do an adjustment for her, and she finds great relief with that. Now, she was excited that I was doing a webinar today on wrist pain. She said, make sure you mention the fact that you've helped me quite a bit with my wrist pain. The adjustments are gentle. They do feel good. We do want to adjust the other bones in the wrist if they're out of place, because we want to get symmetry and proper alignment of all 8 bones. And then sometimes we do adjustments to the fingers and the hand, the elbow, other areas that might be compensating or might be contributing to the problem. We want to restore the nerve flow, especially in conditions like carpal tunnel, where the median nerve can have pressure on it. We want to relieve the pressure and restore the feeling back in the hand and the power back in the muscles. The goal of chiropractic care in the clinic is to reduce the pain, so less or no pain, get more or full movement, get the strength back in the wrist and the hand, and then prevent relapses. So we don't want to see people coming back with the same problem over and over again, and meanwhile their wrist is degenerating, it's wearing out or getting arthritic, and they're having trouble doing their work. We want to correct the problem and prevent it from coming back again. We do talk to patients about lifestyle. This is a good example with this picture of poor posture um, at the desk. I do see this sometimes when people are driving, they have poor posture with the steering wheel. I saw that this morning, somebody really close to their steering wheel, and then their wrists were in a poor position, their arms. So if you're a driver, you're a courier, truck driver, I want to make sure you have the proper posture, the proper ergonomics. We did a webinar a couple weeks ago on ergonomics, and if you go on our YouTube channel, you'll be able to find that. That would be a good webinar to watch in addition to this one on wrist pain. We do talk about posture in general, talk about nutrition, because for the joints, you need certain things for nutrition and the bones too. Things like calcium are really good for the bones to keep the bones nice and strong, especially if there's been an injury. You might need some extra calcium, extra nutrients to heal the tissues and make them strong again. We give exercises to our patients, and then we want to encourage well-being or a healthy lifestyle, which involves reducing stress. It involves regular exercise, drinking enough water, proper rest. All of those things are lifestyle changes that we talk to our patients about. Not all of them need all those recommendations, but depending on the patient, as we get to know them better, we'll give them certain recommendations and things they can do to help themselves to have a better lifestyle. If you have wrist pain, definitely call our clinic. Usually we can get patients in the same day or within 24 hours, so you don't have to wait too long. Currently, we are taking new patients, and there's the phone number right there, 250-486-0062. Our address, we're at 105-1628 Dixon. That's the tall glass towers in Kelowna, right where the white bridge crosses Harvey Avenue. If you have any questions, you can definitely email me at drcaryyurkiw@gmail.com. On social media, definitely follow us. You can go to our website, www.caryyurkiw.com. You can subscribe to our YouTube channel. We have a lot of webinars like this that we record and put up on our YouTube channel. So subscribe to our channel. That'll allow YouTube to notify you when there's a new webinar. And then we do have a podcast. It's on Anchor. It's called Super Healthy, and it gets distributed through Apple Podcasts and many other podcast channels like Amazon and Spotify. So watch for that podcast on those channels if you use them. On Facebook, follow us. Our page is Dr. Cary Yurkiw, Instagram at Dr. Cary Yurkiw, and Twitter at DocCary. I did write a book. It took over a year to write, but it was published last year, and it was on neck pain. So if you have neck pain, you do have wrist pain or arm pain, this might be a good book for you. It's on Amazon. You can borrow it through the Kindle KDP program. You can also get it in audio format or ebook. So it is available. You just have to type my name in, Cary Yurkiw, and neck pain, and you'll see that book. There's one other book there called back pain. So if you or somebody you know have back pain, there's a separate book on back pain. For our upcoming webinars, you found us through our social media or maybe through Eventbrite. On Eventbrite, our page is Dr. Cary Yurkiw Chiropractic, and that's our link. And then the upcoming webinars, we have quite a few coming out. The next one's on whiplash. We have one coming up on sacroiliac or hip pain. There's one on back pain, foot pain, and then stretches for back pain, neck pain, and then advanced stretches and exercises for back pain. So we're constantly updating our webinar schedule. If you do sign up for a webinar, I think Eventbrite will notify you if we add a new webinar to our list. So turn on the notifications, and you will get an update if we add another webinar to our series. If you're in the Kelowna area, you have wrist pain, and you want to come into the clinic, we're giving you 10% off as a special offer. This coupon is good until September 28th, so for the next 7 days, and you can use the code WRIST. So when you call in or book the appointment online, just type in WRIST, and you'll get 10% off the initial consultation. I want to thank you for joining me today. If you have any questions, don't hesitate to email or you can call the number I gave you during the webinar. We'd be happy to help. and we hope to see you or your friends in our clinic soon.